Hi, everybody. Welcome to this week's episode of Coping Together. My name is Faith, and I work with the Mental Health Association of Central Florida. Today, I'm excited to have our guest speakers. We have Windy McCarty, who is the Director of Business Development with the University Behavioral Center in Orlando, as well as Ryan, our Clinical Director with the University Behavioral Center. So thank you both so much for being here. How are you doing today?
Great.
Well, thank you so much for having us, Faith.
Wonderful.
Yeah.
And perfect. So we're here today to talk about kind of what the process and experience looks like for children in inpatient care, what that looks like during the time of COVID-19. But first, I want to ask you guys if you could share just a little bit about your positions so that we understand, where you're coming from.
Sure.
Okay, whoever wants to start.
All right, I guess I'll go. Sorry, it's hard when you're doing it virtually. It's a little different than when you're sitting in person.
Definitely hard.
But as Faith was saying, I work over at University Behavioral Center. I've been there for almost 8 years. It's like my home away from home. My job is I'm a community liaison. What I do is I link individuals in the community with services in the hospital. So if someone's looking for inpatient care or needs information, they don't know where to go, I would be the person that they talk to. So I work with a lot of hospitals, doctors, families, and really just kind of a concierge for whatever service they need. Even if it's not through us, I try and link them with something that's going to help them. I feel so honored to be able to do this. I feel like I get to help people every day, which is, for me, when I wake up, I don't even feel like I'm working. I love what I do. I get to meet so many people that are passionate about helping other people. And it really it gives me fuel every day. I enjoy it. I love my work family. I love working with Ryan. It's been kind of strange working from home a little bit more and not seeing my coworkers. But we are getting along okay through COVID, and we are getting through as everyone else is and just finding a new normal. So I'm happy to be here.
And Ryan, can you share just a little bit about yourself and your position?
Sure, yeah. So my name is Ryan Thomas. I'm the Director of Clinical Services at University Behavioral. So I've been here, I think almost 9 years. So I've been here a while.
Yeah.
So I've been just kind of moved through the ranks here. So I started as a per diem therapist and then became a full-time therapist. I used to run the outpatient program that we had here when we had PHP and IOP. And then I became clinical director probably 3 years ago. So
right.
Yeah, so I've been here for a little while, but definitely, to echo what Wendy said, we're all really passionate here about what we do, and we love to come to work each day to help everyone. And that's our main goal, is to help the clients and just make sure that they have the best possible experience. I know it's difficult sometimes when a person's Baker acted, or maybe they come in involuntarily, but we try to make the experiences as enjoyable as possible and as therapeutic as possible. So we definitely want them to have a positive experience.
Well, thank you so much. And I think that's the perfect segue actually into my first question for you. So again, to clarify, I and myself I work in the mental health field. I am still a student. So there's a lot of stuff I don't know about a lot of things. And one of the things that I'm not really familiar with is actually inpatient care. Can you share a little bit about what that is for our viewers who maybe aren't familiar with the term?
Yeah, I can. Brian, feel free to cut me off anytime. I will not.
Okay. All right, sounds good.
But I can kind of field this one a little bit. So when you're looking at a continuum of care, you have individual therapy, you have PHP and IOP programs, which are like a day program that's a little more intensive. And then the next step up is what we have at University Behavioral Center, which is inpatient care, which means you spend the night while you're receiving services.
And just real quick, PHP is partial hospitalization, correct?
Yes, you are
and
correct.
IOP is intensive outpatient?
Yes.
So that's so just to confirm, thank you. So that's to confirm for our viewers, that basically means those are services that while they are intense, they are still, from what I understand, it's not exactly inpatient care, correct? They're not there.
Right, you go home in the evening. Yeah.
Right.
Okay.
Right.
Perfect. Sorry. So continue ahead with the explanation of
inpatient
care.
I'm sorry.
Yeah.
Yes,
No, you're fine.
But so when patients come over to us, usually someone who's struggling quite a bit. So we work with a lot of folks that might be feeling suicidal or homicidal, or they're in such a space that they're not able to thrive on a lower level of care. So that's kind of what we're looking at. And then we also work with individuals who are struggling with substance use disorders. So if they're needing detox or rehab services, they would come and they would stay with us. And sometimes what that looks like is getting on the right medication or getting back on a medication that maybe someone stopped taking. Or we work with people who've had their first psychiatric break. And, you know, it can be scary, and sometimes, most times, it can be one of the lowest points in someone's life. So this is a really, really important, you know, part and role that we play in helping someone get back to either where they used to be or find a path that's going to help them when they leave our facility.
Thank you so much for that explanation. And so, Ryan, I guess I'll ask the next question to you. And I'm sorry,
Sure.
I'll get us more on a track. I apologize. How would you say inpatient care varies amongst children versus adults and just that whole process?
Yeah, so I mean, the biggest difference is that with the kids, you know, you have the family involvement. And so not to say the adults don't have family involvement or support, but the kids have that guardian or parental caregiver that's there and able to make treatment decisions for the kid. So
Right.
sometimes the kids will come in and it may be that the kids don't really want to be here. And so they'll get Baker acted. I mean, the Baker Act process, that's understandable for people, right, viewing this?
Yeah, so, and we can go over it again. We've done a few videos that kind of touch on it. We're actually going to do another one soon that really goes in depth with the Baker Act. But essentially, the concept of being involuntarily placed in a hospital for evaluation and to make sure
Right.
really that you're just okay, kind of like a mental health check-in.
Yeah.
So yes, thank you so much for asking that as well, and just giving us that chance to touch on it.
Yeah, and so for the kids, you know, you have the Baker Act process is kind of the main referral source for the kids. So, and typically they come from the schools. So right now schools are not in session, or they're doing virtual school, or, you know, who knows what's going to happen in the fall. It's still kind of up in the air. But the main way that a kid would come in is through the Baker Act process from the school. So guidance counselor at school or law enforcement deputy at the school also. So, but with the kids, you know, you have the parents involved, and so the parents would have the opportunity to participate in family sessions, and so the kids would need consent for all medications and treatment from their parents too. So they're just a lot more involved as the family unit overall, and so they have more intensive family therapy.
That makes a lot of sense.
And we really want our families to be involved. It's such an important piece. And Brian, you can probably attest to this, that when we have our families involved, we see probably more successes when families are coming to family session, when they're getting their own therapy as well. And that really, really helps the patient.
So it sounds a lot like that family working together in the interest of the child can really make a difference in the outcome of the child's treatment.
Yeah, for sure.
Absolutely, yeah. And so we really encourage that, you know, the participation piece from the family. So that's part of being here, is the family has to be involved in treatment.
Okay, so that kind of leads into my next question, which we all know that we're in the time of COVID-19 and we're still going to be facing the ramifications of that for a while. But I know that a lot of hospitals, facilities, and places are taking a lot of precautions to protect their clients, but still be able to provide that treatment. So we've talked a little bit about what inpatient care usually looks like. How does the process look now? Like, how is it different because of COVID-19 and those precautions? Whoever again, sorry.
Okay.
I can tell you that for all of our staff, every day when we come into the facility, we're having our temperatures checked. I know we were just talking a little bit about family sessions. We're not allowing any visitation at this point in time, but we are able to do some telehealth visits, just kind of like what we're doing right now with our families. If they want to do family sessions, you can do it that way. So we've really utilize technology to be able to do some of the things that we're limited to do with COVID. We're also, doing the 6 feet of separation. Right, we're checking all of the temperatures of our potential patients coming in as well to the facility. And then we have 2 rooms set up that have a special airflow, negative airflow, that we had specially put in for anyone who might test positive. We have not had any patients test positive, which is a wonderful thing, knock on wood, but we do have those 2 rooms set up in the case that we would need them. Did I miss anything, Ryan?
Yeah, so I mean, I think the biggest change for the adolescents and for the families is that, like Wendy said, the visitation is stopped and now it's on Zoom, but we're also doing family sessions via Zoom as well. So we have that piece. So, I mean, in a way, it's more convenient, I think. So the families can hop on the Zoom app whenever. They don't have to come out in person like they used to. And so our technology has kind of advanced within the building. And so we're capable of providing more telehealth resources for the family, which I think is a positive thing.
I think that's a really great way to look at it, trying to find the light in the situation. And I do agree with you that the accessibility factor has increased for a lot of people when it comes to telehealth, or for the families being able to interact with their child without having to get all the way out there.
Right.
A lot of our families, don't have transportation, or do have 5 other kids and you're trying to work, and it's like, you can't do it all. This has actually been really nice to be able to have this. It's probably something we'll end up keeping even after COVID.
I think so. Yeah, definitely.
Well, thank you. And sorry, go ahead.
I was just going to say, the other thing that, a big change that on the unit, we do a lot more with the social distancing, and we have smaller group sizes now. So our units are designed, the inpatient unit is 32 beds for adolescents. And so we're group size, we keep them to 9 patients per group. So we have the facilitator and then the 9 patients, all 6 feet apart. And that's kind of a big change that we've had. So.
Yeah, absolutely. And so that kind of brings me into my final question for you both, which I'll address it to you, Ryan, and then Wendy, I'd love to hear your thoughts on it as well. But for parents who are having to deal with this experience, how can they, or loved ones in general, like how can they help? What can they do to make the process easier on the child who's in the inpatient care? Because already it's not easy, and with COVID, it's obviously not making things any easier.
Yeah, I think it's tough right now because there's a lot more anxiety, with leaving your kid on a unit away from the home base and away from where it's safe, and you don't know what the other kids have been exposed to on the unit or where they're coming from. But just know that we're doing everything possible to keep them safe mentally, absolutely, and then physically as well. So we're trying to just make sure that we're doing temperature checks, we're monitoring symptoms, we're seeing if there's any changes in conditions. In our treatment center, we have all holistic care. So it's not just mental health treatment that we provide, but we also have the medical staff here too. So we have a medical team that comes in and a medical doctor that sees the kids for evaluation also.
Wonderful. Wendy, do you have anything to add?
I do. One of the things that's not COVID related, but something that we do normally, is we do 15-minute checks. So if you think about that during COVID, if someone coughs or you see a symptom, we're going to pick up on that really, really fast. And the other thing I just wanted to add is, I get it. I'm a mom. I can't imagine leaving my little one at a facility and not being there to tuck them in at night. And, I also see the other side of this working at University Behavioral Center is when families are dealing with kids who might be self-harming, or, you find a knife in your child's room, or open wounds, or, your child is so depressed they're not coming out of their room. Like, that's so scary as a parent. And sometimes you feel like, is this normal? Or, they're teenagers, but maybe they always say this. I don't know. But it's so important to kind of just look for those signs and know that there's a place, whether it's us or someone else, just there are places that you can go. And even if you just get an evaluation, have someone take a look. We do free evaluations. There are other places that do free evaluations too, just to kind of see, is this normal? Is it not normal? What can I do? We'll give you resources. So if your child doesn't need inpatient care, then we'll send you home with resources on what you can do, or, You know, there's some great support groups in the area, but know that you're not alone. There are other kids. There's so many stressors just to begin with, and then you throw COVID on top of it. And being a teenager, like, it's tough out there. It's not easy, and we get that. And just to be able to go away for a few days and concentrate on you. You know, there's no Instagram. There's no one body shaming you. There's no one. You're able to really just kind of figure out who you are as a core person, get stable, get well, be around people that are going to support you and love on you and care for you, and really just want to see you be the best version that you can be. And that's not a scary thing. That's a really good thing. And that's the thing that saves lives.
I think that was really, really well said. Thank you so much, Wendy. And thank you, Ryan, for your thoughts on everything. I think with that, I will actually say that that wraps up our conversation for today. Wendy made an excellent point about, you know, being concerned for your child or anyone. Please feel free to, you know, take a look at one of our previous videos on suicide awareness and prevention. We talk about different resources that exist that can help train you and teach you how to watch for those signs and how to approach that conversation with your child or loved one. Please also always feel free to reach out to us at MHA if you have any questions or think you might need services. Please feel free to check out University Behavioral Center, like Wendy said. Free evaluations to see what's going on. They really all care about the people that come in to their center. So thank you both so much for being here. Thank you to all of you for watching, and we'll see you next time. Thank you.
Thank you,
Thank you.
Bye, everyone.